We actually have two projects at one hospital happening right now. This is a large academic medical center in the Midwest. In this case, we had a leader who was promoted into this position about a year ago now, who is new to the emergency nursing services area, however, has had amazing success as an inpatient nurse manager. So she's taking on a role, moving from a nurse manager role to a director role. And then also at the same time she did this, she moved from inpatient nursing to an emergency department role. So this is a little bit of coaching that we're doing for her on what it looks like to be an ED nurse. How do you talk the talk? What's the language? What's the operational work? She has been highly successful with her results, connecting with her team. The staff love her, but she wasn't really functioning fully as an ED director as we would expect her to. It's not uncommon in nursing that we see people who do really, really well and we promote, but we don't always grow them. And so the CNO at this hospital has really chosen to invest in this leader and help her to grow, to be successful. Our boots on the ground leader there is guiding this work with her, not doing the work, but teaching her how to do the work to improve their length of stay in the emergency department for their discharged patients. We're working on getting that number discharged down. They hold a significant number of inpatients in the department, so looking at patient safety for them while they're in the department, but also helping that relationship to try and help move those patients out of the emergency department more timely with her inpatient partners. So looking at that, working on trying to reduce the length of stay and the left without being seen. Left without being seen for them was up around 9 to 10%, sometimes some days seeing upwards of around 15% because of the number of patients holding, because of the challenges with getting throughput, challenges with effective middle flow in the emergency department. Our last piece that we're looking at in terms of how we're doing with mentoring, the leadership, the dyad partnership, all of those components, our outcome measure that we're looking at for that success rate is actually our patient experience scores. And so we're using Net Promoter Scores on this unit, and we are looking to improve our Net Promoter Score. We are seeing some significant improvements here. We were in the 11th percentile for our informed about delays when we first started. In the first month that we were there, we helped her to implement lobby rounds. So making sure the patients in the waiting room were being rounded on timely, kept informed of what the delays were, what the timeframes were, where they were in their visit progress, and really making sure we were starting in a meaningful way the workup for those patients that were waiting for a bed in the main emergency department. In that phase, that change has moved our Net Promoter Score for that delayed from 11th percentile to the 38th percentile. So significant improvement started there already, and really seeing some true ownership and understanding of the business of emergency nursing and emergency medicine.